This is a topic that is kind of near and dear to me. If anybody that knows me or really been following social media, breast cancer is is super important to me. My cousin Nina, who I just lost, who my family just lost a few months ago to breast cancer. Um, it's tough. Breast cancer affects a lot of families, a lot of people. This is, the T-shirt that I wear still, um, represent her legacy, and it says to keep the fight. And her fight was our fight. I keep the fight by still educating people and help people understand what the disease is, and how to effectively counteract it, and fight it. So her. I appreciate it, Randy. Her fight does not end with death. We all got to die sometime, but it's how we live our life and how we carry on legacies. And for me, how I continue to carry on her legacy is as I teach my patients, and I teach anybody that I can talk to just about the effects of breast cancer. So let's get into it. All right, there are many things that that about breast cancer that we don't know, but there are many things that we do know. And as far as being aware and understanding how, and thanks everybody for your condolences, I appreciate it. And how to understand detection, and how to counteract the disease are extremely important. One of the biggest things is early detection. So with early detection, we are now a 90 to 95% survival rate, or not 90 to 95% 5-year survival rate of the disease, which means that if you catch it early, people are surviving. As for my cousin, there are several different things that played a factor in her ultimate demise from the disease, but she did actually get early detection. All right, so the first time she got detected, she had a lumpectomy, but unfortunately was not treated appropriately after that detection. But I'm going to dig deep into that a little bit later. And this goes on into talking about understanding your physicians, understanding your health, doing your research on physicians, doing your research on your own as far as treatments. Like, man, doctors drop the ball sometimes, and it's up to us to actually do some research and to read and to talk and to ask questions. And if your doctor is not answering questions as far as like your health is concerned, you're leaving with questions and concerns, then it's a problem. Like you have to do your due diligence and find someone that's going to listen to you and make sure that you're getting the care that you deserve. So with breast cancer, a couple of facts, one big thing is that, you know, every woman has a 12% chance of developing breast cancer in this lifetime. So that means, 1 out of every 9 to 10 women that you see walking, your moms, your aunts, your cousins, your sisters, your daughters, are going to develop breast cancer at some point in time in this lifetime. And that's significant. That's huge. This is the second most, uh, you know, prevalent cancer for women, and that can lead to death. It's the second most common cause of death for cancers for women. So that's why it's extremely important. What do we need to watch out for, and how do we do better as far as early detection and understanding what to do if something is going on in your body? All right. So number one, the biggest thing is what we teach is called breast self-awareness. So if you looked at 15, 20 years ago, we were teaching women that you have to do a breast self-exam in the shower every month. and what we were finding is that that there were a lot of, false positives. Women didn't understand what they were feeling. So they'd be in the shower, you feel a lump, you'd be going to the doctor, and then you get mammograms, you're getting biopsies. We're doing a lot of unnecessary things. So what we do now is teach breast self-awareness, and that's understanding what normal breast tissue feels like and what abnormal breast tissue feels like. So understanding that breasts change. All right. So, your breasts every month are going to respond to hormones. So, some months, sometimes certain times of the month, your breasts will feel full. Certain times of the month, you may feel a lump, but you got to ask yourself about the characteristics of that lump. One, can you feel the edges or the border of the lump? I mean, can you actually, does it feel like a marble or pea, or does it feel like it's just like soft and squishy? All right. If the answer to that is that it feels like a marble or pea, you can actually feel it, that's a problem. Number two is if it's mobile, if it's something that you can move around. If you can move it around, that's also a good sign. If you can't, or if it's painful to move, then that's also an issue. If it's hard and you can feel it and you squeezing it and it's painful and you can feel it like a marble, that's an issue. All right. Another thing that breast cancer doesn't do is that it doesn't go away. Right. So when you have these hormones and the mass is not leaving, so you have your period goes away, and then you have a period and your period goes away, and this same lump is still consistently there. Realize that that's not normal. That is definitely not normal, and that's something that you can't sleep on, because a lesion or a tumor that is less than a centimeter, when detected, will give you a 95% survival rate. But it's not until it gets past that centimeter, if it gets bigger, then your survival rates decrease significantly. Who's at risk? All right, so let's talk about the people that are at risk. Miss you guys too, Miss Senorita Key. So who's at risk? So these are the things to look out for, and people kind of freak out about these things. There are many different people that are at risk, but here's a general rule of thumb. If you have if you have a woman in your family that was diagnosed at the age of 45 or younger, right? A first degree relative that was diagnosed at the age of 45 or younger. Number two, if you had a first degree relative that died at less than 50 years old, this is another indication for genetic testing. All right. And we'll talk about BRCA in a minute. If you have a male, all right, so breast cancer is not exclusive for females. Breast cancer also happens in men. So men have to be understanding of your own health. If you feel a lump in your chest, don't think just because you're a man that you can't get breast cancer. Yes, you can. And so as a woman, if you have any man in your family that has had a breast cancer, you absolutely need to get genetic testing. And if you have a significant history of pancreatic cancer, significant history of prostate cancer, men with prostate cancers, or a significant history of people with melanomas in your family, those three things are all indicators that you possibly may need to you get genetic testing. And this is a conversation. So if your doctor is just like, if you rush in 5 minutes, 10 minutes, hey, how you doing? What you need? Blah, 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 kicking you out the door. And they're not asking you about your family history, not asking you about surgical history, not digging into these topics, get a new doctor. And that's me. I don't care. You call me hating, call me whatever. I'm all about, people, I'm not saying that things don't happen in medicine, but it should not be from the lack of taking time out and understanding somebody's family history and everything else. Make sure that you're talking to your doctor. If your doctor's not interested in your family history, get a new doctor. All right. So other things. Let's talk about actual genetics and issues, because I know people are gonna be like, well, my auntie had breast cancer, or my mom had breast cancer, or what have you. If there's any indication, all right, so say I've had a few lumps removed, but they always return. So I'll talk about that in a second, Charlotte. Cousin after passing, I've been concerned on my future, my health. Yes, well, Nina is my cousin as well, so we'll talk about that. I'll go deeper into with the family history. So um, when you with genetic testing, right? So specifically, what they're looking for are for the BRCA gene, all right, and that's the breast cancer and ovarian cancer gene. All right, there's a 1 and a 2. They're on chromosome 17 and 13, which is too much information, but that's where they're at. So people that have mutations in these particular chromosomes are at increased risk of not only breast cancer, but increased risk of ovarian cancer, increased risk of, for men that have it, pancreatic cancer, melanoma, as well as prostate cancer, right? So all of these cancers, when you have significant history or you are positive for BRCA gene, you have to understand that you are at a significantly increased risk. How significant? For BRCA, you are at a 60% risk of developing breast cancer. BRCA2, you are at a 50% risk of developing breast cancer. And with that being said, you're also at the 10 to 20% risk of ovarian cancer in a lifetime. So this is very, very significant. That's why you see, stars like Angelina Jolie, remove her breast as well as her ovaries. She's BRCA positive. So therefore, her risk of developing breast cancer and ovarian cancer in the future are extremely high. So to alleviate that risk, remove the breast, remove the ovaries, all right? For women, and that goes also for, so then you ask about, all right, well, what if a woman has not had hasn't had children and is looking to have children in the future? What do they do? Well, watch very, very closely. But when childbearing is over, then we have discussions for maybe not double mastectomies, but at least oophorectomies, which are removal of the ovaries, which give the hormone to feed breast cancer. Right. On to a few questions that I saw as far as being worried about breast cancer. So it's as far as insurance being paying for genetic testing. All right, it has to be a first degree relative or somebody very close to your family. And to prove that your doctor has to document that, and typically they will pay for it if you could prove that there is a elevated risk, just like those things that we talked about. So for my cousin is that's my first cousin. Not it wouldn't be for me, but all of her sisters, which Deanna, who I saw was on here, she would be a prime candidate for getting BRCA testing. But that BRCA was not the issue with my cousin. As far as like when you should get screening, when should you start getting and looking at like if there's an issue. So in the general public, in the general population, the age is 40. So 40 years old, every woman, you should be getting a mammogram every single year. All right. If you have elevated risk factors, meaning you have a first degree relative or a man or just a high incidence or high risk of breast or ovarian cancer, including BRCA positive or what have you, you start getting those very early. So you start getting MRIs, right? So they start giving MRIs and mammograms at age 25, right? Or 10 years younger than the youngest relative to receive that to not receive, but to develop the disease. So if you had a relative that had breast cancer at the age of 36, you start doing the testing at age 26 if you are BRCA positive. Yeah. So as far as let's talk about the aggressiveness of the disease. All right. So and I can talk about my cousin because I know her, love her, and giving information and using her as as an example and information. I know she wouldn't care. She would actually push me to do it and would be mad if I did not talk about it because she was a person that wanted to fight it, but also wanted people to be aware about the disease. So I'm going to share a little bit about her story, and hopefully, that will help, whoever. If it helps one of you all, then God bless. It's great. Well, she was diagnosed with breast cancer. She felt a small lump and had breast cancer, right? In that, they did a lumpectomy and removed the cancer. It was completely removed. However, there's something very, very important that needs to happen after, typically when you detect or diagnose a breast cancer, you go on a medication, usually tamoxifen, which is the medication that suppresses the ovaries. And what does that do? So it's suppressing the ovaries from producing estrogen. Breast tissue is responsive to estrogen. So you typically will give the tamoxifen for a significant period of time, depending on what the breast cancer is, maybe 2 years, 3 years, 5 years, or what have you, while you're monitoring that cancer, or you monitoring to see if anything else develops or what have you. You're monitoring by giving this medication. In my cousin's case, she was not given this medication, right? So they did the lumpectomy and did not put her on tamoxifen therapy. 2 to 3 years later, I can't remember the timeline, but 2 to 3 years later, she had a lesion that came back. This time the lesion was what's called triple negative. So there are hormone receptors on breast cancer, the HER2, as well as the estrogen and progesterone receptors on these cancers. These receptors, or these protein receptors, are very important because this is how you treat them, right? So if, for instance, if a breast cancer is estrogen positive, estrogen receptor positive, then you would basically, the medications would do that. It would basically cut off all estrogen, which would basically feed the cancer, and you would tailor the medication in that regard. All right, just depending on what's positive on their breast cancer. In my cousin's case, when it came back, it was negative. It was HER2 negative, it was progesterone negative, it was estrogen negative. So pretty much every treatment or every therapy to the cancer was ineffective because it just had morphed into something that could not be treated. And that's, typically patient, and not in my cousin's case, but typically in patients that have triple negative. So if you ever hear triple negative cancer,